want to talk about the positive outcomes from combining hormonal therapy and chemotherapy in the treatment of metastatic hormone-sensitive prostate cancer. With hormonal therapy, I want to focus only on LHRH that are delivered as subcutaneous injections. These are decapeptile, actually. One of them is the Zoladex, the Lupron. Once the LHRH injection is delivered in day 0, there is a surge in androgen levels before the androgen levels go down to castrate range. This medication actually do the effect and the side effects. The side effect, which I will try to explain why I think it's actually the beneficial effect, is the side effect is regarded as androgen flare, testosterone flare. Many of the physicians give this medication is to achieve castration, its level androgens. What mean castrate level? Testosterone is the levels of testosterone achieved when we do orchiectomy for a patient, remove the testicles. So with this medication, initially there is a surge in androgens before the androgens levels arrive to castrate level at about 3 weeks from the injection. So this is a different study that compares LHRH agonist to different medication that I don't want to focus on it right now. So if we focus on the Leuprolide, the LHRH agonist, there is the androgen flare that spans about probably 2 weeks before the testosterone levels goes to castrate levels in 3 to 5 weeks. This study that was published in the New England Journal of Medicine in 2015 actually set the stage for combination of chemotherapy and hormonal therapy. There was better overall survival for the patient who got the combination hormonal therapy plus docetaxel compared to hormonal therapy alone. The main population of patients who benefited from this combination are patients with a high volume of metastatic prostate cancer. Most of the subcategories of the patients benefited from this combination. This arrow shows it's ADT plus docetaxel, androgen deprivation therapy, they call it, plus docetaxel compared to ADT alone. So there was more benefit in this group for most of the subcategories of age, race, volume of disease, and multiple parameters. The groups that were tested, so there was 397 patients who got the hormonal therapy and docetaxel, and 393 who got the hormonal therapy alone. I want to focus on the chemotherapy and hormonal therapy combined. So the docetaxel that was used in this study actually killed dividing cells. It stabilizes the microtubules during the mitosis, resulting in mitotic catastrophe. This is without docetaxel cells, without docetaxel, and this is cells with docetaxel. You see that the cells that are exposed to docetaxel die by mitotic death. It's death while dividing. One of the hypotheses that I tested with my colleagues is the timing of the chemotherapy compared to hormonal therapy. The question was if the testosterone levels or the androgen levels at day 0 is a specific level, and during the first week of treatment there is a surge in testosterone androgen levels. So this surge will result in more prostate cancer cells to go into mitosis. The hypothesis was that if we expose the cells, the tumor cells, in this phase, in the androgen flare part of the effect of the medication, they will probably die more because more of the cells will be in mitosis compared if we wait until more than 14 days, like 3-4 weeks or 2 months after the initiation of LHRH agonist, when the androgen levels are low, and then the drive of cells to divide is much less, so there are much less cells in mitosis, so the effect of the chemotherapy will be less. This was the hypothesis, so we did retrospective analysis of the CHAARTED trial. We excluded patients who had orchiectomy or patients who were randomized to hormonal therapy only, patients who didn't receive the docetaxel, or patients who received the docetaxel in the same day that the ADT. Like there is a need of a few hours for the androgen flare to occur. We excluded these patients, 2 patients who started in the same days. These patients, we compare patients who got the chemotherapy, it's the same chemotherapy, within 1 to 6 days from the first injection of LHRH agonist, Lupron or equivalent, compared to patients who got the same chemotherapy more than 2 weeks from the initiation of this first dose of LHRH agonist. And what we found was there is a trend for better overall survival if the patient got the first dose of docetaxel within 1 to 6 days from the first dose of LHRH agonist compared if they get it more than 2 weeks. There was a trend for better progression-free survival. These are patients who started within 1 to 6 days compared to more than 2 weeks. And there was significant difference, better outcomes in castrate-resistant prostate cancer-free survival for patients who received the chemotherapy, the first dose of the chemotherapy within 1 to 6 days from the initiation of LHRH agonist. So simply just the timing of the first dose of chemotherapy can change the outcome of the patient. So if we look at the tumor cells, the cancer cells as monster cells, monster cars. So we try to make castration for the patient, unfortunately. We try to press on the brakes to slow the division of the cancer cells. But this slowing of the division doesn't kill the tumor cells. So what the hypothesis that we're trying to prove is, can we use the accelerator to actually, rather than the brake that we use, can we press on the accelerator? And the answer is we can do that if we time the chemotherapy immediately during the androgen flare. This is the androgen flare, the gas, and the chemotherapy is the ugly wall. So if we want to crush the cancer, the prostate cancer cells, we need to time the androgen flare of the LHRH agonists such as Lupron with the timing of the chemotherapy. Chemotherapy should be given 1 to 6 days, preferably 1 to 3 days probably, from the first dose of LHRH agonist. And now we are trying to develop protocols to test them in clinical trials where we give short-acting LHRH agonists that result in androgen flare without the ensuing castration. LHRH agonists that have half-life of 20 minutes. It's called gonadotropin. It's the same hormone that is secreted from the hypothalamus in humans. So we want to test that hormone that have half-life of just 20 minutes that can make androgen flare without castration after that, and to test giving it before each of the 6 cycles of docetaxel. We think that we'll be able to achieve better outcomes and hopefully cure of these of some of these patients with hopefully lower doses of chemotherapy. Thank you.